Hello, I'm just waiting here for more people to join. I'd like to welcome every one of you to our monthly webinar that we've been having the first Saturday of every month. So I hope everyone hears me okay. We're still waiting for Dr. Gutierrez to join with us. Okay, so I'm going to go over one thing before we get started is that I want to make sure that people who have not submitted a health questionnaire before, they go ahead and do that. And by going to Mexico Bariatric Center.com/health questionnaire and fill out the health questionnaire. If you have done the HQ before or you have approved with different surgeons, we need to switch you for this raffle. So if you're doing a fresh HQ, please select Dr. Alejandro Gutierrez as a surgeon of your choice. The raffle would be performed at the end of the presentation after we go over all the question and answers that we can cover, and we would do the raffle. So the requirement to be in the raffle is to fill out a health questionnaire and be present to the end of our presentation. And these are for surgeries that Dr. Gutierrez does perform. Okay, so again, hello everyone. I want to welcome you to our monthly webinar for weight loss surgery in Mexico with MBC. My name is Ron Ellie. I'm the founder and CEO of MBC, and I'll be having hopefully Dr. Alejandro Gutierrez joining us shortly and continue our presentation. Again, if you have not filled out the health questionnaire, please go ahead and do so and select Dr. Alejandro Gutierrez. Make sure that you listen to the end of the presentation, and we would be doing the raffle at the end. I see Dr. Gutierrez is joining us. I can see him. Again, we would have a Q&A session at the end of our presentation, and we do try to cover the most common question asked in the presentation itself. So please pay attention so we don't have to answer the same question over, and we try to cover more questions for you. Hello, Dr. Gutierrez.
Hello, everyone. How are you?
Great, great. Good to have you.
Thank you.
I just started a few minutes ago, so thank you for joining us.
Sorry to be late.
Oh, no problem, no problem. So, okay, so basically the topics that we usually cover in our presentation is listed here. We basically talk about obesity, risks risks of being obese and weight loss surgery. And then we cover what MBC, Mexico Bariatric Center team does and what is it that we can do for you. And basically, Dr. Gutierrez is when he's going to take over and talk about all of our procedures we cover. We have a wide range of bariatric procedures that we can cover in our center, laparoscopic, endoscopic, all the different options of revisions, and so on and so forth. And also, we will cover emerge talking about vitamins, the necessity of taking bariatric vitamins, when we talk about emerge. And that's when we start our answer questions and answer session. And like I said, we try to cover as much as we can, but if we basically are, if time doesn't allow, we basically do the raffle. And that's when we end our webinar. So by definition, or like a medical term that they use, is basically body mass index, which is BMI. That's a measurement for seeing obesity. And as we know, obesity is a chronic disease, is a metabolic disease. And it's proven more and more as we go, especially with all these drugs that are out there right now, shows that this is a metabolic disease. And basically, as human history, you look at where not long ago, people used to eat just maybe one meal a day or maybe two meals a day maximum, and basically dependent of how much they had access to food. And activity was a part of their everyday life, which is lacking for a lot of us. And the existence of all the sugary drinks and what they call ultra processed foods, fast foods, we're exposed to a lot of factors that are contributing to this epidemic. And our genetics, of course, plays a role, our environmental exposure, and how we were brought up, the developmental history. And again, the nutrient content of food, it's never been this high. And other factors like stress, when we get stressed, we start eating. That's a comfort eating. Not getting enough sleep, because we have to work two jobs. And, the drugs that we take, those all have factors, a lot of the antidepressants and medications like that is causing this problem to be even more pronounced. So then he asked me, so we're back to this BMI formula that is basically we just plug in our height and weight and it gives you a number. It's basically just a number, but it kind of shows where you're standing in this chart. Green, which you see is below 25, is the healthy range. And then when we go above 25, below 30, we still in the healthy but a little overweight. And then after that is what medically considered obese. And of course, after 40 BMI, and it's morbidly obese and super morbidly obese and super morbidly obese, and goes on and on. One thing I need to mention here, that our center can basically handle a lot of different procedures and different BMIs that we can handle in our center. Like, for example, we've done a BMI easily of over 100, even 90. You watch these TV series about my 600-pound life. That's we are. We have I would say, a lot less limitation of what we can do than a lot of other centers that are out there. The amount of expertise that we have, that we're offering, is off the chart. We see so many our surgeons colleagues that are coming from different countries to just watch what we're doing in our center. Of course, we will see later on what is it that we can exactly offer, but I'm just giving you some ideas. Talking about fat cells, okay? So adipose tissue or fat cells, before we thought, okay, we gain weight, we just get more fat cells, but really that's not true. The fat cell structure changes as we gain weight, and that's is shown on that demonstration on my right side of my screen, which you see a lean adipose tissue or fat cells structurally different from an obese fat cell. And this change of chemical change causes all the insulin insensitivity, leptin insensitivity, not being responsive to therapies, as well as a lean person, and even like not responding to vaccinations as well. So again, we don't have to go over this. It's a common knowledge, especially after COVID. We realized that what are the risk factors for being overweight and obese? And, this problem, unfortunately, is affecting US as well as the rest of the world, and 40% of Americans are obese, for example. I like to show this video simulation of what happens when we gain weight.
Consider this. Our diaphragm is one of the major muscles that helps with breathing. Breathe in the diaphragm contracts, and it's expanding to get oxygen. But if you're obese, that abdomen can push on the diaphragm.
So basically, that's one side effects of being obese is on our lungs. And of course, there are so many more side effects, and like heart disease, high blood pressure, diabetes type 2 is really a very common problem. You name it, we have all these problems coming, which we call comorbidities, that comes with obesity. Now, again, during COVID, we realized that being overweight and obese is not helping. There is more chance of ending up in a hospital, more chance of ending up in the ICU, more chance of dying. So now the question is, okay, so how do we get rid of these problems? Of course, classical diet and exercise. It's always been there. It's always out there. A lot of people try, but it's not successful. Of course, exercise is essential to our existence. We have to always be active, try to do exercise. But if you're obese, that is not enough to get rid of your metabolic disease, basically, right? So, and then it becomes, okay, so what other options are there? Pharmaceutical, they've been always trying to find with this magic pill that will you take and you lose weight. Of course, we will cover some on these injections that has been out there for past few years and well known as Ozempic. I mean, there are family of drugs. The Ozempic, we go with the Mounjaro, all these different ones that we cover a little bit. And so those are also not a proven long-term solution. So the only long-term solution proven that is quick and sustainable is that we know at this time is bariatric surgery that we are covering today. As far as I know, at this point, the only drug that is, the only injection drug that is FDA approved is Wegovy, that is in shortage, and the manufacturers somehow say that it has a hard time keeping up with the supply, but at the other end, Ozempic is available, but Ozempic was actually, came about to get rid of diabetes type 2. And that's effective if your, A1C levels are high. But then at the same time, there were some, as you wish, it was a surprise side effect, but people started losing weight. But it's not really Ozempic is not a drug for weight loss if you don't have diabetes type 2 problem. And there are known and unknown dangers of taking that drug. So, but unfortunately, because Wegovy is not available in the market, so people are using Ozempic, and then there are some, like, it could be gastric paralysis and things like that, serious problems that can happen. And then again, you are taking this and you're losing weight, but at the same time, if you stop, you're going to regain the weight. So it's really not sustainable. It's just that you have to keep taking it. Of course, insurance covers some and doesn't some. And if you were to pay out of pocket, is at least $1,000 a month, depends on the dosage that you use. So the solution that we covered is really the definitive solution for obesity at this time still is our gastric sleeve, gastric bypass, duodenal switch, and maybe for some people, the non-invasive like ESG and gastric balloon, and those to help them lose weight. Talking about diet and exercise, why is it not effective? When you go on diet and exercise, basically your metabolism goes down, your hunger goes up, and your satiety decreases. And the reason is right here. Because, again, obesity is a metabolic disease, and to get rid of this problem, you have to change your metabolic system. So let's say if a person that is in red that weighs 250, at that level at that weight, your brain and your gut hormones are interacting at that level, which is your body's thermostat or your metabolic system thermostat. And if this person, let's say, go on strict diet and they do boot camp type of exercise, not just like, little exercise, this is extensive, and they manage to lose 75 pounds, this person, the brain and the body's thermostat is used to that 250. That is not changed. So therefore, the body is going to react by making that person more hungry and lowers the metabolism, so it doesn't burn fat. So it's always pushing that person to go back to where it was at 250. Now, when this person goes through the operation, the minute they wake up, the changes in the hormones changes the interaction between the brain and the gut hormones, and that's what changes the metabolic system. We call it metabolic reset or whatever you call it. That changes, and that causes the hunger goes down and metabolism goes up. So that's why you burn fat fast in the first 2 years until you get your ideal goal weight, and then you won't be as hungry. So now the question comes that bariatric surgery is an expensive operation. And if you were to pay out of pocket, at least you're looking over $15,000, $25,000 for gastric sleeve, and even more for bypass. In US, in Canada, of course, there's a long wait time. And if you were to pay out of pocket again, is over $20,000. Some insurance companies cover this procedure, but then they have you pay out of pocket. They have you do so many different, tests and psychological tests and this test and that test that you really end up paying a lot more than you would have paid if you use medical tourism. So medical tourism basically in Mexico is when you go to Tijuana or Guadalajara and use expert medical services at a discounted price. So when we talk about medical tourism, you have to distinguish, who is it that I'm going to, which center, what do I use, a coordinator company or not, coordination company or not. But just to show you, even CDC, which is the US Center of Disease Control and Prevention, recommends that you use a facilitator or a coordination company because they provide the transportation, they provide coordinators that are there to meet you, make sure you go to the right place at the right time, and you are basically have a system that is proven, and you are using that company to do this medical tourism operation. So that being said, you also want to, look at the company, their reviews, their, patients' testimonials, how long they've been in business, what type of services they offer to make sure you're not just going to a center not knowing where you're going. And that is when MBC comes in. We've been doing this since 2012. Of course, myself, I've been in this industry for I started in 2007. So we've been around. You are not talking to a company that just was created yesterday with a beautiful website and a nice Instagram post that put some pictures before after pictures. We have proven record of who we are, what is it that we do. You see a lot of, especially like in plastic surgery, that all the surgeon does is they post some pictures and, well, you don't know what is behind these pictures. Actually, you can get access to these before after pictures, and you can, it could be a stock photo that you buy. But MBC is a corporation in California that has been around since inception. Our mission has been to provide highest quality weight loss procedures at the most affordable prices. So if you ask me why MBC, these are the reasons and more. Again, our reputation, our reviews, on Google, on Facebook. I will go over another feature that is really setting us apart from other medical tourism companies is our surgeon liaison, the way we handle the health questionnaires coming in, matching the best surgeon with each patient for each procedure. Our, our surgeons' qualifications, experience, knowledge, expertise. Again, if you go through us after surgery, it's not like we say goodbye and not talk to you again. You can always call us. We have an office in Sacramento. We have offices, of course, a lot of remote people that are working with the company, but our main office is there. We have administration, we have our programming, we have our coordination all in one place. And again, with MBC having 10 years of experience with over 20,000 successful surgeries, that's our resume. We are offering medical tourism insurance. Of course, that's optional, but that's something I really recommend you do at a discounted price. And these are all the benefits that you get coming with us. Another effort that we've been putting for years now, and we started beginning end of 2021. I'm sorry, actually 20, and that has been starting our own surgery center, and it's been in the works, and hopefully we would have that open to even do a better job, offering the VIP treatment of our patients coming in. This is just some shots of the center going live soon, hopefully. And this is kind of early on. That's Dr. V. That was, again, over 10 years in the business, having 20,000 plus performs successful surgeries and having the top bariatric surgeons in Mexico working with us. That's a resume. So our packages are all inclusive. So that means your surgeon fees, your hotel nights, hospital nights, pre-op test, post-op test, hospital fees, nutrition support, before, after support, surgery support, our surgeon liaison, our nutritionist in our staff, in our office actually. And again, the optional MTI. And we basically, it's a very straightforward system we have, and it's a straightforward packages with, there's no gimmick or, of course, for example, the package includes a standard medication, and if you need something more, you just pay that, and it's not very expensive. And let's say if the surgeon finds hernia that needs to be repaired, you basically gets repaired, and all you just charge you, and it's not, again, is not breaking your back. Our process is very simple. You fill out the health questionnaire, you choose a date and the surgeon, and after you get the approval, and that's it, you put a deposit, you be on the calendar, do the paperwork, arrange for your travel, whether you fly or some people we drive to San Diego to get picked up, and that's it. We even have set up the system so it will be easy for you to book yourself online if you wish. So support is a huge part of the before after procedure. we have several Facebook groups, of course. And the main one, which is our past patients, have over 10,000 active members. And we have another one, which is inside, which inside is basically for people who are on the fence. And some past patients are still in that group, but basically you can join that group to see how it feels to be on the losing bench and being receiving the procedure. And you know, these are real people, real stories, real before after pictures. Another, you know, you ask me why NBC. Here's another reason. This is only 6 of our past patients that are working with us, supporting you guys. Sarita has been with us, I don't know how many years. She's active on Facebook, supporting people. If anything, you know, you can reach out to her on Facebook. Rena, great asset. Dawn, again, you know, these are all patients that are dedicated to us. They are just go beyond, you know, what it can be done for each and every patient. Kelly, Elizabeth, Jamie just joined us. So this is just some of the, just our affiliates that we call affiliates that are working with us. Again, Rena and Sarita do a podcast. I really recommend for you guys to jump on those. Are very, you know, it's coming from people who have done these, have gone through this journey, and they have changed their life for best, and they're a role model for the rest of us. Again, you are just flying or driving, whether you fly or drive, you show up in San Diego airport, our drivers are ready to pick you up because we know they have access to the same information that we have access to, which means your itinerary, when you're coming, how you're coming. We recommend you arrive before noon, so we have enough time to do all the pre-ops and everything else the day before surgery. And we recommend that you leave after 2 p.m. And that's pretty much what we are asking for you to do. Now, if you don't have access to the flight, for example, to leave at 2 or 1 p.m., you can still opt to stay one extra night, whether in San Diego. We have actually, I just confirmed that Hampton Inn in San Diego International Airport still is giving us the 169 plus tax rate. So please make sure if you're using that hotel, mention your NBC and get a discounted price. This is a great deal because right now, as you know, the prices of the hotel are through the roof. Talking about why NBC, network of exclusive surgeons that work with us. Dr. Miguel Montalvo, great scholar. Dr. Luciana Valenzuela has been with us since inception. She's also a patient of NBC herself. She went through this procedure herself. Dr. Alejandro Gutierrez, which we have a pleasure to have him with us today. And Rodriguez Lopez, great surgeon, can handle a lot of different situations. Jacqueline Usuna, she's a surgeon that I know from a long time ago. She's been one of the pioneers of bariatrics, and Dr. Jesus Ceja. So that's our flow of handling your health questionnaires. When you submit an HQ, it goes through our surgeon liaison. Surgeon liaison is basically a doctor that has been educated here and educated in Mexico, is bilingual, sitting between your HQs and the surgeons to make sure every HQ is routed to the right surgeon for the right procedure. This is what distinguishes us from all the different medical tourism companies. Our surgeon liaison, she's working like her heart is into this. With her expertise over, I don't know, 8 years of working with us, with all these different surgeons, she's instrumental to the company, instrumental to the patients. So that is what you get coming with us. Just going to touch base on this. This comes up quite a bit. People ask, well, how much pre-op diet do I need to do? So the pre-op diet is really something you do to help with your surgeries, help with your body, and help with the surgeon to do a better job on your surgery. It can be ranging anything from 2 days, clear liquid, to 8 weeks. Again, please make sure you do a good job, whether you are a 2-day clear liquid or a 2-week, do a low carb, high protein diet that helps you, help your surgeon do a better job. Our surgical team. Again, we are working on Azar Hospital, which hopefully, it's been a difficult project because it's so extensive. We are using the best of the best in this center, is already COFA-PRIST certified. Basically, if you were to get a certification from the Health Department of Mexico, you have to be standards all the way to the JCI, which is international. They scrutinize everything and all the processes, all the design, construction equipment has to be up to date to the best of the best. And this is what you're going to get hopefully soon. We're looking hopefully before the end of the year. We're still using Hyatt, and there are some changes again. COFA-PRIST is basically tightening up a lot of different rules down in Mexico, which is great for everybody, including patients, because that means that your well-being is being considered, whether you're in a hotel, whether you're in a hospital. So remember, that we're working with the best of the best. We're working with Hyatt, we're working with Marriott, companies well known everywhere. They provide top quality services that you get anywhere in the world. Okay, so this is actually important. It's kind of a gray area. Dr. Gutierrez could cover this, but anyway, we want you to stop blood thinners 1 week before, stop NSAIDs like Advil, and please pay attention to the instructions that when you get approved, if you're on a medication, we're going to let you know what to start or stop. And again, if you're taking some medication on a regular basis, please bring the bottles with you. Not just the medication, bring the whole bottle with you to Mexico. But again, the instruction comes from your surgeon, whether you're before or after procedure, after operation, what medication to stop or start, okay? Pre-operation. When you come before noon, our driver is going to pick you up. We take you and do all the pre-op tests, and then you check into the hotel. Right now, we're using Hyatt, we're using Fairfield, and we're using another hotel that we're talking to. But no matter where you stay, don't feel like you neglected. These are all like high-end hotels, and at no means you're like, but if there is a availability or less availability, we have to switch you, depends on which hotel has that availability. It's not like before that no one is going to Tijuana. Tijuana is becoming a destination for travelers, for tourists, for companies. You see all these companies like Samsung, Toyota, so many medical companies are coming, manufacturing companies coming. So the demand is really high. And we do the best we can to accommodate you. But remember, we are competing with so much other demand, and the prices of hotel have gone up so much. Like I know rack rate for like Hyatt, for example, is over $200 a night. But anyway, so just work with us and we try to accommodate you the best we can. Relax in the hotel, just show up at the time they tell you in the lobby. The driver is going to take you to the hospital, and the surgeon is going to be ready for you to do the procedure. And just, I mean, it's okay to be nervous, but don't be too nervous. You are in good hands. We have it all covered from all different angles. You stay there, depends on your procedure, 1, 2, 3 nights, whether it's a gastric balloon or sleeve or bypass or DS. We do all the tests necessary, and you be on your way going back home. Again, if you have your flight figured out, you fly out that day. Otherwise, just stay in San Diego, or you can stay with us in Tijuana. You can tell your coordinator about your itinerary and all that, of course, and we will be making note of it. Again, I need to touch base on surgeons' load management. So because we've been doing this for so long, and we have a system in place that measures load of each surgeon for each day. And basically, we cap maybe 3 or 4 surgeries per day per surgeon. And they don't work 7 days a week, or they don't work one day 10 surgeries and 8 surgeries. I mean, it's shown that after 5 or 6 surgeries, there is there's higher chance of a surgeon making a mistake. And that is contributing to our lowest complication rate, which is less than 0.5%. This is less than 1% complication. And these are not serious complications. They're like, if it's the most difficult one, probably is bleeding, which we notice because they're there to check everything, and we will do intervention. So again, just make sure you comply with the pre-op diet, post-op diet, and comply with the surgeon's instructions as far as taking what medications or not. So as long as you do that and not like lift heavy weight and things like that, just make sure you comply with all that, and you should be good. Again, that's why we also offer the discounted MTI, which is the medical tourism insurance. I'm going to cover a little later on. So here I'm going to give a little intro for Dr. Alejandro Gutierrez. He's a surgeon, has been with us for so many years. Great track record. He is a fellow of American Society of Surgeons, and he's double board certified, which you hardly find in Mexico. He's not only a general surgeon certified, he also a bariatric certified. His education, his performance, his specialties is just speak for itself, highly recognized surgeon that we work with. I'm going to let Dr. Gutierrez take over here, talk about different options that we offer in our center, and talk about each procedure, and then I will be joining back. Thank you so much, Dr. Gutierrez, for taking time. I'm going to let you take over here and go over these procedures. Thank you so much.
Thank you, Ron. Thank you, everybody, for being here with us, taking your time. Talk a little bit about MBC, about myself. That's my team. We have all kinds of options for surgery that there are approved by FDA. Most of the surgeries are the ones that you know: gastric sleeve, gastric bypass. But we have all kinds of surgeries. The new endoscopic therapy, which has its indications, but still we manage to do them. So we have the options down there. Maybe you've seen them all around internet. So we can do each and every one of them. So we're gonna go and see one of them, or most of the most common ones, and we're gonna explain. And after our presentation, we can answer some questions. Okay. So we were talking a little bit about the drugs, exercise, all of it. Since 1991, the National Institute of Health back in the US stated that bariatric surgery is the most effective and durable treatment for obesity. You can have other options, and they can have some results, but not as much or as well as bariatric surgery. We can have some dieting and exercise. It could be good, and actually, we recommend that when you do a bariatric procedure, you continue with diet and exercise. It's a complementary tool. So you have to take care of yourself, learn how to eat the proper way back again. So we have that if you do a diet and exercise, you can lose a little bit, like 3 to 5% of your excessive weight. But this is the same when you stop doing it, or you can have some diseases, some stress. You can gain that way back. We have the medications, and right now Ozempic, which is a GLP, glucagon-like factor type 1. It's becoming, or people are talking a little bit more about this. This medication, semaglutide, is it was meant for patients with diabetes type 2. Semaglutide and all the GLP-1s are a type of incretins that our body makes. It's mostly made on the intestines. So this hormone that we can call it, it helps. It's an anorexigenic drug, so it takes your appetite away or decreases very much. It decreases your emptying of the stomach, so food remains a little bit more in the stomach. And one of the most important thing is that it helps the pancreas produce insulin, mostly when you have a lot of load of glucose in your blood. So we have those hormones in our body, and right now they're doing some studies because this is for diabetes, but in patients with diabetes, they lose weight as well. But they're doing some studies of patients just on sole weight loss therapy. Right now we have like the results are like 5 to 10 to 15, sometimes 16% of your excessive weight. But this is the same. You have to be doing a weekly shot, increasing dosage. And if you take it right away, you're gonna regain all that weight back. And we have some complications. Patients could have nausea, diarrhea. They can develop cancer and the thyroid, some other complications. So it has its indications. And right now, for just solely to lose weight, it needs more studies, and it's not as well as bariatric surgery. We have some endoscopic procedures there where that will do some research. Right now we are doing it all around the world. We have the gastric balloon. This is a balloon. Well, this is just made endoscopically, so no surgery, no incisions. Endoscopic procedures can help you lose weight, but not as much as a bariatric surgery. So this has its indications. So if a patient is a low range BMI and want to lose some couple of pounds, so this is a good option. So we have the gastric balloon, the endo sleeve, Toray, different procedures that maybe we're gonna go through all of them. And then we have the bariatric surgery. So this you decrease 60, 75, 80, sometimes 90 if you do a good diet after the surgery. So it continues to be the most effective and durable treatment for obesity and its related comorbidities. So we can go to the next one. Okay, so to go to the most common type of procedure. So we have the gastric sleeve. Gastric sleeve is the most common bariatric surgery done all around the world. This they started doing it since 2000. It was a part of a two-step procedure. So they went in and they did the sleeve, and then they wait a couple of months and they continued it. But they saw that patients were losing a lot of weight, or they were happy with their results. So it became a one-step procedure, and right now is the most common one. This consists mostly, we're gonna go to the stomach and we're gonna remove approximate of 80 to 85% of your actual stomach. So we're gonna leave a tiny portion, long portion that looks like a sleeve. And the function is, obviously, you're gonna get full very fast. It's a restricted procedure. And second of all, we're gonna take all of that other part of the stomach, we're gonna take it out. And that portion, mostly the fundus, produces a lot of hormones, but most known one is ghrelin. That it's a hormone that your body produces, and produces more when it's empty. And this hormone goes into your bloodstream, to your brain, and causes you that hunger, that binge eating sensation. So after not having this part of the stomach, your body's gonna produce it much less, and you're not gonna have that hunger sensation anymore. So expectations, we were talking about ghrelin, which is called the hunger hormone. There's a lot of hormones, but this is the most known one. It could increase the levels of GLP-1s, the glucagon-like peptides. We were talking like Ozempic, semaglutide. Increases another hormones of PYY, which is another hormone that decreases hunger. And the GIP is another hormone that has the same effects as GLP. Right now we are doing some studies. It has to, well, we've seen that with all these changes to put a all these changes makes your diabetes, your glucose levels decrease, your diabetes goes away, your high blood pressure, even some type of tumors, sleep apnea, all of that. So all of these changes make you shift to a healthier you. We can have some pros and cons. The pros is that gastric sleeve, because it's a simple surgery, so we just manage the stomach, so we can go, and if you regain weight, we can do a revision quickly and easy. You can, well, you decrease weight. I tell my patients, it's an excellent tool. It's still a tool. You have to make some changes. The gastric sleeve it's a push. The gastric bypass is a bigger push, but still you have to make some changes so you don't decrease that much of a weight. Comorbidities, that's very important. You're gonna see that your sugar levels, blood pressure, if you're using a CPAP machine for sleep apnea, problems with fertility, even that's going to be relieving and going away, and you're going to stop taking all the medication that you take. This is a restricted procedure, so no malabsorption, no rerouting. We just go and make your stomach smaller. There's a slight chance that in every restricted procedure, as the lap band or the gastric sleeve, because of that small stomach that we leave, pressure inside that small stomach increases. So there's a slight chance, like a 20-25% of patients that could develop or keep having some acid reflux. But this goes in hand by your taking your diet and doing exercise and taking care of what you eat. So this is, you could still have some acid reflux. If some patient they have bad acid reflux, the treatment is to convert it into Roux-en-Y gastric bypass. One of the cons, it could be non-reversible because we're gonna take most of the stomach out. But this was in the past that we've seen that patients, they can go the other way and have some malnutrition. Right now, it's very, very rare. Still, there's some cases, but it's very rare. So you won't go the other way. Okay. Well, the gastric sleeve is very, very fast. It's like 45%, 45 minutes surgery. So it's very quick. We have a special type of gastric sleeve that it's called single incision. This is for some special patients that has their BMI, it's low, mostly static condition. So in the inside, it's the same, but we do the surgery to the belly button. So it's just one incision, bigger incision, but it's just one. So mostly for aesthetic reason. So, okay. We can go to the next one. The endoscopic gastric sleeve, we were talking about endoscopic procedures. This is made to an endoscope, so it's just a slight sedation. You don't have to go into surgery. And what we do from the inside is that we suture the stomach to put it, it's like a gastroplication on the inside. So it has good results. They're not the same as a complete gastric sleeve, but what we've seen is that if patient has a lower BMI range, it's a good option for them. So, and no surgery. Okay. We have the gastric bypass surgery. Since the beginning of bariatric surgery, this was a long time ago, 1950s. Gastric bypass was considered and still the gold standard for bariatric surgery. So what happens is this is called a malabsorptive surgery. So what we do in this
I guess, sorry for the interruption. Dr. Gutierrez's Wi-Fi just died. So I'm trying to get him back in. No problem. Sorry for the delay. Again, we just lost Dr. Gutierrez as he was going over the gastric bypass procedure. Please try to get back in. Again, okay, so just to save time, I would like to maybe talk about something that is frequently asked is, when do I go back to work? When do I lift weight? When do I swim? When do I start using, doing my everyday normal life? And this chart basically covers type of the procedure you had and the type of the activity and how long you need to wait. So in general, you want to listen to your body, first of all. Going back to work depends on what type of work you have. If you have a office job, or if you have, you know, lifting things or driving. So depend on that. You need to take a week or two before you go full time. Of course, a little bit longer periods for bypass to the node switch than gastric sleeve. Gastric sleeve is a little faster recovery. Talking about walking, we recommend walking, but just take it, slowly, gradually, toward the, longer walks. And lifting at least, I would say, 6 to 8 weeks. And oh, there you go. Okay, so I think Dr. Gutierrez just shown. So for lifting and heavy duty workout, at least 6 weeks out. So I was just trying to save some time, went over what kind of activities they have to wait for how long. So I'm going to go back. When we lost you, you were talking about bypass.
Yes, yeah.
So,
sorry, problems with the connection. Apologize.
No problem. Yeah, no. So I'm going to let you take over again. Thank you.
Okay, so yeah, sorry. So we were talking about the bypass. So the function of this is that all of this bypassing, this rerouting, that food is gonna bypass that portion of the intestine. So it's gonna go, instead of going through the whole intestine, it's gonna go to the last portion of it. So not getting in touch with food, not absorbing calories, not absorbing as well vitamins and minerals. So you have to keep in mind that in every bariatric procedure, so we recommend for you to continue taking vitamins, your minerals, your protein. Obviously, if it's not the same on the gastric sleeve than in a duodenal switch. So obviously, if it's a bigger surgery, you're gonna need more help with vitamins and minerals, and can get malnutrition a little bit more often. But just keep that in mind. So this is a gastric bypass. It helps a lot, and as well as getting rid of comorbidities that we were talking about. You can have some cons. You can have some complications, some marginal ulcers, mostly if you are a smoker or take NSAIDs like on a daily basis. And you can have dumping syndrome. Dumping syndrome, you could have it in all bariatric procedure, but mostly in malabsorptives. So this happens because we're gonna create a connection between the stomach and the intestine. So this is mostly if you eat too fast or a lot of carbs, a lot of protein, that it's gonna go directly into the intestine. So the intestine doesn't know how to handle it at first, and it starts liberating a lot of hormones. So you start to sweat, heartbeat increases, diarrhea, you can even faint. So this is just learning how to eat a good speed, slowly, and not taking a lot of carbs at one time. So that's it. Surgery takes around 2 hours, more or less. So it's not much of a big surgery, but it's bigger than the gastric sleeve. Okay. Obviously, when we read the health questionnaire, patients, they have an option for say what surgery do they want. Obviously, we can accept it, but when patient comes here and we see all their background and talk to them, we said this surgery could be better, or this is better for you. So there's not that one is the best surgery than other. It's the best type that is for each patient. So normally we have that gastric sleeve. It's well for the lower range BMI. If you previously have some scarring tissue, mostly on the lower part, so we don't get it in the lower part, just in the stomach, so we can do the gastric sleeve. If we were talking about ulcers, mostly on smokers, it's better not to do. It's better to do the gastric sleeve. It can be revised easily. We do not alter anatomy because we don't do reroutings. We just go to the stomach, and we have good excessive weight. This is at 1 year. Normally we have the results we compare at a year. So we're expecting to lose. We have our ideal weight, and what's on top of that is our excessive weight. So we are aiming on getting rid of 65-70% of that excessive weight. And in the BMI, in the gastric bypass, this is a good option, or the treatment for patients that have a bad acid reflux, because we're gonna reroute that, and acid's not gonna go all the way through the esophagus, not anymore. So it is a good option. Sometimes, well, you have to take care. I was reading one question that they were talking about, if I continue eating after surgery, this is gonna work. This is a tool, but if you do not take care of eating habits, and you still keep taking a lot of carbs, a lot of liquid carbs that can go easily, so you're gonna regain weight. And normally with time, our body tends to create some mechanisms to absorb calories, because calories, it's our energy. So the body is not made to throw our fuel away. It's to absorb it. So you have to just keep that in mind, but with a good help by a diet and exercise, this is gonna help a lot. Okay, and the excessive weight is a little bit bigger, aiming at 72%, 75%, sometimes 80% if you use it properly. We have a special, this is a special type of gastric bypass. It's called a mini gastric bypass, or OAGB. It should be called one anastomosis gastric bypass. This is done by an omega loop that we call it in surgery. Omega loops, we were doing this since a long time ago. We switched to the Roux-en-Y for a time, but then after Dr. Rutledge back in US, he started doing the omega loop, the mini gastric bypass. So we good results, and FDA just approved it almost 10 years ago. So what we saw is that the losing weight is the same with the Roux-en-Y and mini gastric bypass, or sometimes even faster with the mini gastric bypass. It has its advantage. In this case, we're gonna go to the stomach, and we're gonna create the pouch on the upper portion. Obviously, in the mini gastric bypass, it's a little bit longer. But the difference is, we go to the intestine, we count the same 8 to 8 feet, but we do not cut it. We take it as it is, and we brought it into that pouch, into the same intestine. So that's why it's called an omega loop. So it's called mini because instead of doing 2 cuts, 2 suturings, 2 staplings, is just 1. So it's like 15 to 20 minutes less surgery, but because of this, it's called mini. But it's not like it's a mini surgery. It's just because it's quicker. It has the same results as the Roux-en-Y. Obviously, if patient had bad acid reflux previously, so we prefer to go to the room Y. Okay. The surgery is almost the same. So the same that we were talking about, what should I get, the Roux-en-Y or the mini gastric bypass? What we see that is that obviously patient has acid reflux, we go to the Roux-en-Y. If patient sometimes they have some conditions, heart conditions, any other conditions that we want to do the faster surgery, so the mini gastric bypass is a better option. Sometimes the intestine, it has its vascularization to a fat tissue that's called the mesentery. So sometimes the mesentery in some patients is very short, so it doesn't let us pull it up to the pouch. So in these cases, the mini gastric bypass it's a good option for that, to not leave it too tight. It could have some later complications. Okay. We have the Glenelg switch and the Sadies. These are very good surgeries, but this is like the upper most invasive surgery. These surgeries are for patients that they have some conditions that they need to lose weight faster, because if not, they're gonna have complications or even death. So what we do in the Glenelg switch is it's a little bit different, because in the Sadies, we go and do a gastric sleeve first, and then in these two surgeries, we're gonna leave the pylorus. So the anastomosis, the binding, we're gonna do it on the duodenum. So the duodenal switch is compared to the Roux-en-Y, and the Sadies is compared to the mini gastric bypass. But in this case, we, instead of cutting the intestines from the beginning, we're gonna count it from the end. So leaving like 8 feet, something's a little bit longer. So we're just gonna leave a tiny portion of the intestine absorbing calories. So we're gonna reroute all the intestine. So, and then we take that intestine and bind it to that duodenum. So it's a bigger surgery. It helps, obviously you lose more weight, but you still have to take more care on what we're talking about about vitamins and minerals and protein. So patients sometimes can have a little bit more of diarrhea. This depends on your eating habits, but if you eat properly, this is going to help a lot. Okay.
Okay, so thank you so much for taking time and doing educating us about these type of surgeries. We've been doing seminars before pandemic, and we've gone to so many different cities like Seattle, Georgia, Atlanta, Canada, but now after COVID, we've been sticking just to our webinars. Of course, as I've always said, if there are, enough people to sign up around your neighborhood, you can, get that information to us, and we will be more than happy to travel to where you are for actual seminar. But this has been the format that we've been doing. And so as long as there was one question about, so when you're in the recovery period, the maximum weight that we recommend you can lift is definitely less than 25 pounds. And even like when you go onto the plane, please make sure, when you have to put your suitcase on the, overhead bins and things like that, just be careful, not to extend yourself too much. We are also live on Facebook, and we're trying to answer those questions as well. And so I'm just trying to keep track of both places. So now we're coming to financing. First of all, our packages are extremely affordable. If you consider the inflation, all the cost of living going up, our packages starts at $43.95 for a gastric sleeve. That is, is a great deal. But still, if you have a need to get a personal loan or a medical loan, you can check out some of these companies that I've listed here. You have a lot of the banks that you actually are banking with. They could be a good option, like Bank of America, all the credit unions. They have great options for low interest. And because they have a relationship with you, you can get an easier loan, and get a better term loan. SoFi, those guys are all online. You can download their app. But what I want to make sure that you're aware of is don't apply to too many places at one time, because that's going to hit your score. And try to do maybe one, two at a time, and make sure they're not pulling your credit. Okay, so medical tourism insurance. We have hooked up with the best company that offers this package. And this package basically covers for, complication, some of the expenses that can happen because of travel interruption. And we have got this package down to $149. That's the deal of the year. That's the deal of the century. That it covers you up to $25,000, of course, maximum of all this, for that much money. And it's basically a peace of mind. And hopefully you never need it, but it's just to have it is a great option. This package, it costs about $400 if you were not signing up with us. So you're getting, deeply discounted, affordable package for medical tourism insurance. Bariatric vitamins are specific for bariatric patients, like gastric sleeve bypass DS. And we have our line of bariatric vitamins called Emerge. These come in soft chew, chewable, drinkable, and capsule. You can order these when you are filling up your paperwork. There's an option to order it. You could also go on emergebariatrics.com and you can order those, and you can put yourself on an automatic refill. Again, just make sure which one is the one that fits you best, because you're getting a new stomach. But at least the first 2 years for gastric sleeve, you need to take these, because it has the exact ingredient that your body needs. And these are made of best quality ingredients according to the ASMBS standards. So just for bypass and DS, I think we should indefinitely take these, because we all lose weight after bariatric surgery. And we have this honeymoon, but what you want to look at is long-term, 5 years, 7 years, 10 years down the road, when you don't have problems with your bone density, you won't have problem with your nervous system, all this stuff that you don't want it to happen down the line. So now we're going to open to Q&A. I tried to answer some of them. I guess Dr. Gutierrez has also been having his eyes on this. So let's go ahead and try to answer them. Claudia, they had some more. So Claudia is asking Spanish. So let me go over some of the ones. So we talked about insurance. So that's extra cost, yes. So now So the situation with the hospital is, okay, so when we started like 10, 12, 14 years ago, there were very limited options in Tijuana. Me Doctor Hospital was one of the only centers would be specialized in bariatric surgery. And, you know, they do a good job for most parts, but a few years ago, we realized that to be able to offer high-end procedures that we've been offering and having the patient receive the best possible services for the most affordable prices, we needed to move on to this project, which we call Project Azad Hospital. And we've been working diligently with top, engineers, architects, medical professionals to make this hospital so it will fit our needs for our patients' needs. This is not a hospital that has emergency and this and that. It's basically tailored around what we do exactly. And going from where we are working to this hospital would be 10 step at least high. Is state of the art, is one of the best centers that can be working in Tijuana, anywhere in Mexico. Even better than so many places that I have been in US. So that's a project. Again, because we wanted all these amenities and everything else in the hospital. It has taken longer than we expected. Hopefully, we will go online before end of the year. And we are not Me Doctor Hospital. Me Doctor Hospital was just a center that we were using, and we basically grew out of it. And we saw this, maybe 4 years ago. And that's what this project has taken place, to be able to meet, have the vision to foresee what is coming, what's the need, what's the, standards that we want to meet down the line, 2 years, 4 years, 6 years from here. So at this point, our companions are going to the hotel once the patient leaves the hotel and goes to the hospital. You do have visitation hours, but we don't keep the patient in the hospital. And this has really started right after pandemic. So we didn't want the contamination. We didn't want the companion to go in and out and bring all the different, germs and COVID viruses and things like that. And for most part, we liked it because, yes, in certain ways, the patients are more comfortable to have their companion around, but the companion, the first night they stay in a hotel with them, and they can come and visit them the next day, But overall, if you think about the safety and the protocol for being, germ-free and as clean as possible for our staff, for the patient's sake, for everybody's sake, that's the best way to go. And honestly, I don't know, the places that take the patient and companion stay there in the hospital, those probably are not up to code. Let's put it that way. Because if they're up to code, they wouldn't be doing stuff like that. And again, you want a company to go to have certification for their operation. Their surgeons are certified. Their hospital is certified. Everything is certified. They're not doing anything funny, or, pay to operate. You want a company that is standalone, they go by the rules, they do the, safety protocols, everything. So you won't have any, like you see so many different meningitis, stuff like that is happening, in the other parts of Mexico when patients just pick a center to go because of price or whatever else. So these are the consequences not going by the rules. So as far as seeing the doctor, I guess, especially Dr. Gutierrez, he's one of our best surgeons that has great bedside manners. And you do see the surgeon before the surgery. And we've been talking about that. A lot of times they ask, is bypass is better for me or sleeve is better for me? First of all, when they are evaluating your health questionnaire, they would tell you which one is better for you. But if you signed up with a procedure, you're not tied up to that. You can still have a conversation with your doctor when you're down there and pick the best choice that fits you most. And all these about, how much time, um, how much weight do I lose? Is it 60% or 72% of my excess body weight? But I mean, look at our affiliates or the patients that we're in contact. Patients lose all the weight they want. They basically get to their ideal weight. And you have acquired a tool that you can always work with. About 5 to 10% maybe needs revision. Bad things happen in life, and you gain weight, but most of the time, the patients are successful. Gastric sleeve is a great tool, so is the other ones. So again, yes, you do talk to the surgeon. The surgeons are available to you even in the last minute. If you decide, yes, I want to go with a different type of surgeries, and your surgeon agrees, that's the surgery you're going to get. Okay, so let's go back from the beginning. And so I'll let you, Dr. Gutierrez, talk about Michael when he's asking what happens to people who have bypass and return to alcohol consumption and poor diet.
Okay, yeah, we were talking a little bit about it, that every surgery is an excellent tool, but it is still a tool. So this is a big push, but you still have to make some changes. If you do not prepare yourself, or after that you keep eating, you're having bad habits, taking a lot of alcohol, carbs. So obviously the body, it's gonna absorb that, and you're gonna regain weight, and morbidities can return. So this is a tool. So you can make some changes, learning how to eat the proper way back again, and by time you can continue that, it's going to be help. And then we recommend that you have some help by a nutritionist, by your primary care doctor. This is for long-term um, uh, evolution. So you can still have everything. You can still have some alcohol, eat what you want, but in a small amount, in the proper amount. So but the question, if you do not take care of yourself, so obviously you're gonna have all the bad consequences, that even if you don't have a bariatric surgery.
So, they're asking about Wegovy, and so this actually has come up that, again, the Wegovy is in shortage. I don't know if you guys have access to where you are, but from where we are, I know there is a shortage nationwide. So, and that is the only semaglutide injection drug that is FDA approved at this time for weight loss. And so the question is, can I take this after, if I regain after surgery? Yeah, I mean, again, that's why Dr. Gutierrez went over that pyramid where it shows, endoscopic procedures doesn't work for everybody, but it works for some people. So you have to see what's your lifestyle, what works for you as an individual, what is your commitment level, and are you comfortable with taking injection every week to lose weight until you stop and you regain it, or you want a definitive solution? Again, these are just hormones that you put in your body. When you put hormones in your body, you don't know what the long-term consequence of it. When you do bariatric surgery, basically it changes your hormones naturally. The GLP-1 and PYY, all those are naturally created. So it's not like you're putting some hormones, extra hormones to take care of your sugar and glucose and some for this or that. So again, yeah, there are some recommendations that yes, it's okay to take injections if you regain weight. And I let Dr. Gutierrez, answer more.
Yes, actually, right now they're doing a lot of studies that in patients that after bariatric surgery that they regain weight, they're giving them some GLP agonist injections. So having good results, but you have to keep in mind that in all of the results that we have right now, it's like you get rid of 10-50% of your excessive weight. So it's not gonna get the whole weight back again. So, and this has to go by hand in your eating habits. And as we were saying, it has some side effects. The cost and the side effects that you get. Patients have frequent diarrheas, nausea, and you can have some type of cancers develop. Most of them is medullary thyroid cancer, or you can have kidney stones, dehydration. So different kind of things. So right now it's in the study. It's not. We don't have a good report, but yeah, it's looking good. But it has to be a global treatment. It's not that the injections by themselves are going to take all the weight off of you.
So again, the hospital is not in use. Hopefully we will be coming before end of the year. I let you answer this one, Dr. Gutierrez, about testosterone.
Haven't seen it. I got lost. Oh. I don't see it. Oh,
So it's asking, is it required to get off testosterone replacement before a gastric sleeve?
There are some patients that they have some testosterone treatment. You can obviously you will have to get off of the medication right before surgery, but then after you can continue having your regular medication, helped by your primary care doctor as well. Because sometimes the levels, your just natural testosterone levels are going to increase a little bit. So maybe the dosage will be changed. So, but yeah, just right before surgery, you stop taking that, and then right after, you just go to your doctor and they continue your regular treatment.
So there was one question on Facebook of, they asked to be for the new hospital, what's look like. So we have little screenshots of the new hospital, and I do have a video that I kind of skipped, but let's go back and revisit that. Okay, so I'm just gonna play this real quick. Yeah, so then we had some, this is like the waiting area that is showing here, or reception. That's the downstairs lobby, a nurse's station, and you see again one of the patient's rooms here. This is one of the greatest centers that once it comes online, it will be a game changer. Sorry, let's go back to, so there was a question on Facebook about this. The Claudia is asking a question, Doctor. I don't know if you see it. Dr. Gutierrez, she's asking about, I think I cannot, you see that? Claudia is asking in Spanish.
Claudia Lasso, I saw one that says thanks. Let me. Claudia Lasso, there's a sleeve that can be done endoscopically. That's the question, or? Oh.
Well, there is a question she's asking about the hospital in Spanish, and
I don't see any of it in Spanish.
asking about nutrition, I think.
Claudia. I didn't see it right here. Let me go to the answer ones. Yeah. Don't see it. Maybe if she can ask it again. Claudia.
Okay, maybe I translate that. So let's go to Raquel. She's asking, I had a RNY 10 years ago. Never got close to my goal weight. I found that only time I seem to lose weight is when I'm highly restricted diet.
Okay.
And heavy exercises. I'm considering a revision like DS. However, I'm not sure if that's a good option for me. I'm nervous. I'm 5'3", 243 pounds. I have high blood pressure, and I've been taking HBP meds for over 3 years now. So any guidance you can provide?
Okay. Yeah. We can do a revision surgery. It could be different factors. Sometimes with the bypass, sometimes the pouch can enlarge a little bit. And long ago, back at that time, this was all around the world. We made smaller bypasses, like 1 or 2 feet of a bypass, because we were scared about malnutrition. Right now, we've seen that we've been increasing that portion of a bypass. So right now we're 6-8 feet all around that. So yesterday I did one revision as yourself. The bypass, it was 2 feet, so we enlarged it to 8 feet. So we can do a revision. If you were to go and have a duodenal switch, it could be as well. But obviously we have to do the less invasive, which and could be the best one for you. So yeah, we can help.
So I translated what Claudia was asking in Spanish, that how is the hospital, which we explained as much as we could, does it have the right conditions? Is there a support group for post, I don't know what aspirations mean.
Maybe like goals, it could be
Surgery? After
aspiration.
surgery, like psychologists, nutritionists, we do not have psychologists, we do have nutritionists. We have done this before, that if patients needed a psychological evaluation, we would do this when you get to Mexico, but then, we can schedule your surgery, and then depending on what that outcome is, you would or not get your surgery done. And then again, we talked about companion in the hospital. So we answered all those questions. So this is, again, I'm just going to read this because we've been explaining this a lot, but I'm just going to read it again. She's asking, I don't know if he or she asking that I'm a teacher and substitute teacher, actually, and I want to know how to get to this $2,000 off raffle. Very simple. You do a health questionnaire. You have to be approved, of course, by Dr. Gutierrez, and you just have to watch this webinar to the end. We do the raffle at the end. We pull somebody's name, and that's it. Very simple. How do women do after having a baby, after they had surgery, before the baby? What is that like? What is that like? So if they had surgery and they get pregnant and have baby, what is it like?
Okay, so actually, with the surgery, your fertility chances increases. So there's a lot of former patients that got pregnant after surgery. Actually, one of my aftercare physicians, we did surgery on her, and she already has 2 kids. So it's the same. Obviously, that if you had a gastric sleeve and you have a small stomach, mostly iron, vitamin B12, some different factors are gonna get absorbed less likely or in less percentage. So you have to keep taking your proper vitamins, minerals. I would say that in a higher level than in a patient that doesn't have any bariatric surgery, but you can undergo your pregnancy the same without any change. You just go to your doctor, to your OB GYN, and tell them that you had the surgery, so they can have in mind. So keep following that. Maybe they can now and then do some blood work to check on your levels, and that's the only thing. Other than that, it's normal.
Okay, so can the stomach regrow around the sleeve after surgery?
Okay, that's a common question. Normally we talk about the stomach can grow a little bit with time, but this is because the stomach's mostly muscle. It has 2 layers of muscle, so with time it could grow a little bit. It could stretch a little bit, but not as much as the original size. So we're gonna take like 80% of your stomach. So I would say in some patients it could grow a little bit, maybe to say maybe 5-10%, because it's muscle. But this is gonna depend a little bit of if you're taking care of your eating habits. If you eat a lot back again, so the stomach increases a little bit. What we do here is that we staple the stomach, and then we oversew the whole line of staples. So this helps with the regrowing. So because you have the staple line, so your stomach is not gonna grow that much back again.
When doing, oh, okay, so they're asking, can they add crystal light powders to their water when they're on their clear liquid pre-op diet?
Okay, yeah, sure. Actually, you can take non-sugar or light jello as well. But yeah, you can add that. What we want to avoid is carbs and mostly fat and protein. But yeah, you can do that.
About removing extra skin after bariatric surgery. We are actually working pretty good right now with a couple of surgeons that each one is specialized in certain type of plastic procedure. Usually plastic surgeons offer to do all type of face, body, surgeries, but we pick the ones for each procedure, what's the best option for each patient, and we use, of course, plastic certified, and sorry, I gotta, so surgeons, and we are working also with surgeons that are not only board certified, they're also expert in post-bariatric patients, which they have a certain requirements. And so in order to get that going, you really need to do a health questionnaire on Mexico Cosmetic Center. And I'm just putting the link here for you. And so, yeah, and then we get your HQ and we work with it and make sure you are being taken care of. Is it okay to still drink wine after the surgery?
Yeah, we were talking about later on after surgery, you can do your regular life. At first, we have some restrictions. We want to avoid caffeine, smoking, having alcohol. You have to keep in mind that well, if you do the gastric sleeve, and alcohol is gonna get absorbed faster, so you can get drunk faster. So later on, if just tasting, not that much of a drinking, yeah, you can do your regular life later on.
I have controlled seizures. What my concern is, I'll be able to swallow my medication after surgery. How is that handled?
Okay. Yeah, we have some previous former patients with the same condition. Um, you can, if you can, well, we recommend right after surgery for patients to uh, for the medications to crush them. Mostly the first week. Some patients they can take it as it is, but this could cause a little bit of discomfort. But if you can and you take it as it is, well, you can use your regular medication without any change. And this could be just the first week. Later on, patients can take their medications normally.
They're asking if they help patients book their airfare. We don't. We can still, you can still talk to us about it, but we don't actually book your flight. Just have to consider, whether going on Expedia, finding what's the best option for you. You can also check out Southwest Airline because, the accommodation they're giving, an easier way to reschedule your flight. but these are all options out there. So they're asking if I get the sleeve and get a horrible heartburn or a GERD, can I still get a revision to mini bypass?
Yeah, well, yeah, you can. We still have to ask you. The best thing in that case will be to get a Roux-en-Y bypass, but depends on what you have, and if it gets better with the diet and all that, you can still get a mini. But I would say that if you had a bad acid reflux, the best way is to go to a Roux-en-Y revision.
And then the same person is asking that if you can't take NSAIDs and they have inflammation and pain like arthritis, what would be the option to get over the pain?
Okay, yeah, well, you can later on have NSAIDs. It's not that you would not be able to. At first, we recommend because it can have some more bleeding tendency. Um, and this is mostly in the case that patients take it like on a daily basis as it is. We have different other types of anti-inflammatory drugs, like paracetamol, for example, or different type of medications. But later on, and it's mostly if it's not on a daily basis, you can be able to take your NSAIDs when you have any inflammation or pain.
Okay, so let's see what we got here. They've been asking couple of people about gallbladder removal and is it okay to remove it or not, or should I remove it? So maybe you want to give some guideline of what's the best way to go.
Of course. Yeah, this is as well a common question. Um, we have to keep in mind that any condition that makes you lose weight faster could develop gallstones and the gallbladder. So long ago, I would say like 30 years ago, it was a condition that whenever we did a gastric bypass or any bariatric surgery, we have to go and take the gallbladder out as well. It was mandatory. Right now, we've seen that patients they can develop gallstones, but it's like in a 20-25% of them. So what we recommend is that well, if you want to, you've been having some problems with it, we can take it at the same time. If not, we can leave it. You do a follow up with your doctor, as it can do some ultrasounds now and then, and just keep in mind that you can have that. But the same, it's not mandatory. But if patients sometimes want to take the gallbladder out as well, we can do that.
Okay, so I'm going to talk about two of the questions that are travel related. They're asking about do I need passport? We highly recommend you have passport card or a passport book to be, have no hiccups when you crossing the border to US. And they're asking when is the payment due? So when you get approved, you can put the deposit of 350 or 500 and you be eligible to go on the calendar and get scheduled for surgery. The payment is due 2 weeks prior to the surgery. Let's say if you are paying by cashier check, you just send a good picture of your cashier check, and then you take it with you to Tijuana and they collect it on the day you arrive. Credit card, easy. You just go online and pay it 2 weeks prior. So the sooner you complete your files, the sooner you take care of the payment, less of a challenged to, to focus on your well-being, your surgery, which is actually, that's where you go down there for. We don't want to be hassling with all different side issues when you're actually your purpose is to go down there and get surgery. There were some other some questions, medical questions. By the way, we are going almost to 2 hours, and we need to we're probably going to take just one more medical question, and that's it. If my mother had a blood clot in her procedure, would I need to be concerned about the same outcome for myself?
Okay, well, all patients that have surgeries, they can develop blood clots. So this is prevented by, obviously, you saw the picture patient having their stockings. We use blood thinners quick enough. We recommend start walking, moving around. If you have previously or relative, maybe it was condition or maybe it was because of the surgery, but we still take all measures. And it's not that if in that case your mom had it that you're gonna have it, but we take all those measures to prevent that. And obviously having a quick clean surgery, it also helps.
If you develop dumping protein intake, how is that treated?
Like if you have a dumping syndrome, well, dumping syndrome is a normal reaction of the body. It's like when you sometimes we get and our blood pressure lowers and we feel dizzy, or sometimes we can faint. It's kind of like that. So it's a couple of minutes. And this is what we were talking about. This is because a lot of carbs go into the intestine, so it's a normal response of the body. So normally, if you just let it rest a couple of minutes, and it goes away. Obviously, to prevent it is to eat slow, separate liquids from solids, and not eat too much carbs or protein at the same time. So
Yeah, we almost do. About age factor. We take anything from 16 years old to maybe 72, but then again, depends on your condition, your health condition, your psychological condition. But that's a range that we work with. Again, it just depends on each individual. One thing that actually I need to bring up is doing a blood work before you come to Tijuana or Guadalajara. We do not require that, but it's a great idea, especially for patients who have had previous surgeries, because when you had, like, let's say, sleep before, bypass before, your hemoglobin tends to be lower than normal. And when you get there, if you don't know that, it will be delaying your surgery. There's going to be implications. So the best way to do it is do the test here. If you know you're low, take care of it here. So when you come down there, you have no problem. Again, we do our own blood test down there, but this is just for your own comfort and convenience. Okay, so we do have a winner because I mean, we tried to cover all the questions. If your question didn't get answered, please let your coordinators know, and we try to get back to you. However, so we're just gonna have to stop here. The winner of this webinar is Sylvia Manning. Sylvia Manning, I see you still there. I'm gonna let you talk. So if you can, please talk to us and share your story with us and tell more about yourself. You're still on mute, Sylvia. Hello, do you hear? There you go. Sylvia Manning, do you hear me? Oh, well, unfortunately, she's not capable of, yeah, you need to unmute yourself and see if you can do that to share your I want to hear your voice. And okay, so please contact our coordinator's office and we try to get in contact with you to get you scheduled for $2,000 off of the package. I want to thank for all of you that took time to join us. I want to thank Dr. Gutierrez for his generous giving us his time and share his information. I look forward to seeing you guys the next time, and good luck to all of you. Goodbye.
Bye. Thank you.
Bye.